Hello, everyone, again, and welcome. I'm so glad you're here for today's webinar, Beyond GLP-1s, Exploring Additional Weight Loss Solutions. I'm Brittany, a health coach here at Shed, as well as a social media manager, and I'll be your moderator for today's webinar. As many of you know, GLP-1 medications have become a major player in the weight loss space, but something a lot of people don't know is that they're not the only option. Whether you're navigating side effects, struggling with cost or availability, or just feel stuck in your current routine, this webinar is designed to help you explore clinically supported, sustainable alternatives and possibly even additions. Here at Shed, we pride ourselves on being your complete wellness journey, so we are excited to dive into these additional weight loss options today. So to start us off, I wanted to deploy a little bit of a poll that I would love for you guys to participate in. The question is, which weight challenge resonates most with you right now? So I'm going to go ahead and put that poll up so you guys can answer. Poll has been launched. And so as you can see, some of the options there are cravings, plateaus, low energy, or all of the above. So go ahead and click the one that best describes your current experience right now. I'll give you guys a few more seconds here to answer, to put in your answer, and we will use these answers to kind of guide the direction of today's webinar. All right, we got some good answers coming in. It seems that cravings are by far the most selected answer. All of the above is in second place. Low energy is in third place, and then plateau is in last place. So it seems like cravings and kind of a mixture of all of the above is that common challenge that a lot of you guys are experiencing. Awesome. Thank you guys so much for participating. All right, now I am excited to introduce our guest, Stephanie Mazurek. Stephanie is a clinical pharmacist at Strive Pharmacy in Tampa, Florida, where she brings together her background in compounding pharmacy and her experience as a former collegiate tennis player to deliver practical solutions for weight management based on clinical insights and commonly used protocols. She has a passion for helping people understand their options, especially when it comes to exploring effective tools outside of GLP-1 medications. Today, she'll walk us through 3 powerful alternative solutions, who they might be right for, and how they work. With that, I will go ahead and turn it over to Stephanie to get us started.
So thank you for the introduction. My name is Stephanie, as Brittany mentioned, and I'm one of the clinical pharmacists with Strive Compounding Pharmacy. I'm really excited to talk to you today about some non-GLP weight management solutions offered in conjunction with Strive and Shed. So as I mentioned, or as Brittany mentioned, I was a former college athlete, but I've also dealt with the challenges of weight loss and weight gain multiple times throughout this journey. And the desire to stay in shape and cultivate my routine was actually one of the many reasons I began playing tennis in the first place. So I've recognized that weight loss isn't linear and there tend to be plateaus, obstacles, things that always come up along the way that I've experienced firsthand. So that is why I'm excited to talk to you today about our options that can help kickstart your own journey. So whether you're just taking the first step or continuing to persevere and looking for extra help, we want to continue to support you and provide you with the tools that can assist you on your journey. So let's get started. Just to cover our agenda for this presentation today, we'll be discussing first what is compounding, so you're familiar with what compounding pharmacies offer, then go into looking beyond GLP-1s, as well as our 3 medication combinations that we're looking into as non-GLP-1 options, which would be naltrexone and bupropion, metformin naltrexone and topiramate, as well as MIC plus B12, an injectable solution. And then at the end, we'll have time for some questions from the audience. So what is compounding? Let's begin by talking about what we do as a compounding pharmacy. I work with Strive to provide customized medication solutions tailored to patient-specific needs. We create a wide variety of custom formulas according to what your doctor sees most fit to you, versus having you be a fit to a commercial medication on the market. So we can accommodate custom strengths, dosages, and formulations. We can accommodate patient allergies, create combination medications, as well as intervene during medication shortages, just to ensure that we're meeting your individual needs. So now we go into looking at why go beyond a GLP-1. The purpose of the webinar is just to talk about weight management therapies beyond the GLP-1 medication. So while I love our GLP-1 options, commonly referred to as semaglutide or tirzepatide, they may not be a fit for everyone. Some of the barriers to GLP-1 medication may include the following. So one could be the high cost of the medication. And while we work as a compounding pharmacy to provide affordable and accessible GLP-1 medications, the cost can certainly add up over time. Another limitation may be the side effect profile. So we encourage the gradual titration of GLP-1 medications to limit the risk of side effects. However, nausea, diarrhea, low blood sugar all can occur from these medications. Additionally, limited availability may be a risk factor. So the market landscape is always changing for these medications, and there are multiple variables that can impact a person's availability to access these medications. And lastly, contraindications. So for any patients who are not familiar with this term, it's a medical reason that a patient should not be on a particular medication. Some of these may include medullary thyroid cancer, sometimes called MTC, or multiple endocrine neoplasia syndrome, or MEN type 2. These are very specific endocrine conditions that can prevent someone from taking a GLP-1 medication, but other limitations may include an allergy or hypersensitivity to the medication or its components, along with pregnancy, history of pancreatitis, or severe GI diseases can all impact someone's candidacy for a medication like a GLP-1. So now looking into our non-GLP-1 options and exploring beyond semaglutide and tirzepatide. Our first combination that Shed has to offer is naltrexone plus bupropion. And we can go into what it is. It's two medications combined into a capsule to assess appetite and food cravings. So let's talk a little bit about how it works. The first medication, bupropion, is known for boosting levels of a certain chemical messenger in the brain called dopamine, as well as neuroepinephrine. These chemicals play a big role in regulating mood, motivation, as well as appetite. So by increasing their levels, bupropion can help curb your appetite, making it easier to stick to healthy eating habits. Bupropion is often used as an antidepressant, but unlike other antidepressants available on the market typically, bupropion is associated with weight loss, whereas many antidepressants are often associated with weight gain. So that's one of the unique aspects of that medication. But many people also notice an improvement with their mood and focus, which can be really helpful when you're trying to make lifestyle adjustments. Additionally, the second medication, naltrexone, which is personally one of my favorites, works a little bit differently. It blocks the brain's reward pathways that are involved with emotional or reward-driven eating. So, in other words, it can help reduce the urge to eat for comfort or in response to stress rather than hunger. So this can be particularly useful if you find yourself eating in response to emotions or cravings, even when you may not be physically hungry. So by combining these two medications, we can target both physical and emotional sides of eating. And the goal is to help you feel more in control of your appetite and cravings, so you can make healthier choices and see the results for yourself from your weight loss efforts. So now going to the bottom, some of the potential benefits. It can assist with appetite and craving control as mentioned, which is one of the biggest challenges in weight management. Second, because it can improve mood and focus, you may find it easier to stay motivated and stick with the plan. Third, this combination is a non-stimulant and non-habit forming medication, so it doesn't carry the same risks that other habit forming weight loss medications such as phentermine may carry with that medication. And finally, it is significantly more cost effective and may be less expensive than your GLP-1 therapy. Looking into who is a candidate for this medication of naltrexone and bupropion, we also find it especially helpful for people who struggle with emotional eating or what we sometimes call food noise, which is one of the areas that naltrexone excels in providing that benefit. Food noise might be that constant mental chatter about food, cravings, or urges to eat when you're not physically hungry, something I'm quite familiar with. But if you find yourself eating in response to stress, emotions, or out of habit rather than true hunger, this combination might be a good fit for you. And then, as with any medication, it's important to consider the safety and side effects. So, most common side effects people notice with naltrexone and bupropion are nausea, trouble sleeping or insomnia, and dry mouth. So, some people may experience headache, dizziness, or constipation as well. These side effects are typically mild and tend to improve as your body gets adjusted to the medication. So this is one of the reasons when you're starting this medication, we typically start with the lower amount, like 1 capsule daily for the first week before increasing the dose or number of capsules taken throughout the day. These capsules are formulated with hypermellose, which is a specific ingredient that's intended to modify the release of the capsule, prolonging the absorption and effect in the body. So it's something that's unique to compounding. And then in considering the safety and side effects, there are certain people who shouldn't take this medication. So that may be patients on opioid medications or people experiencing alcohol use disorder. If that's the case, you should not take this medication. However, naltrexone blocks the effect of opioids, so taking them together is not recommended. We also ask you to be cautious if you're taking an antidepressant. You should look at the compatibility since bupropion also has antidepressant properties, or if you have uncontrolled high blood pressure. Now looking into the next medication of metformin naltrexone along with topiramate. So what is it? It is a once daily capsule that combines 3 medications, metformin, naltrexone, and topiramate, to target different pathways that contribute to weight gain and weight loss, and can make weight loss more difficult. So it's intended for people who have struggled with stubborn weight, insulin resistance, or conditions like PCOS, especially for those who may have hit a weight loss plateau despite their healthy lifestyle changes. So diving into how it works, each medication in the combination tackles a different aspect of weight management. So we'll go ahead and start with the first ingredient of metformin. This is best known as a diabetes medication, but it also helps with weight loss by improving insulin sensitivity and supporting better blood glucose control or blood sugar. It can help reduce hunger and even alter the way your body processes and stores fat. So metformin may also influence hormones in the gut and brain that help regulate appetite. So this is a drug that has been used for a long time with diabetes and has shown the ability to lower our blood sugar, thus resulting in additional weight loss. Naltrexone we have already touched on, but again, it has that benefit with craving control, works on those brain's reward pathways that are involved with emotional or reward-driven eating, as mentioned previously, and it can help reduce cravings. Additionally, we see it used in multiple weight loss combinations or formulations in conjunction with GLP-1 medications to help with that food noise. But again, both of these medications that we've discussed so far have that naltrexone backbone to assist with food noise and overall craving management. Lastly, we'll see topiramate. So this is medication was originally used for migraines and seizures, but it has been studied for its potential to suppress appetite and its metabolic benefits. This appetite suppression may help you feel less hungry and more satisfied with smaller portions. So hopefully the idea is to make it easier to stick to healthy eating habits. It may also alter taste, which can decrease the desire for high-calorie, fat-rich foods. So by combining these three medications, we're able to address multiple root causes of weight gain all at once through insulin resistance, appetite regulation, and emotional triggers. This multi-targeted approach can help break through weight loss plateaus and support more sustainable results. And as mentioned, what I really love about this one, as well as our previous medication, is that naltrexone backbone. This medication has so many potential benefits outside of weight loss, such as improving sleep and reducing inflammation, which are, while these factors may not be directly tied to weight loss, they can help support healthy habits and further assist with weight loss. Two key factors with our weight journey. So then moving into the bottom here, the potential benefits. Improved control over appetite and cravings may be one of the benefits we see. It also supports mindful eating and healthier habits, targets weight loss pathways, multiple weight loss pathways, which may help reduce weight more effectively than using a single agent alone. And lastly, with that metformin piece, we see better blood sugar management and the potential for insulin regulation. And then moving on to who might be a candidate for metformin, naltrexone, and topiramate. Potential candidates could include people with obesity, insulin resistance, or polycystic ovarian syndrome, also referred to as PCOS. So this is a complication of the endocrine system that can result in insulin resistance as well as hormone imbalances among women. And other potential candidates can include those who may experience strong cravings, emotional eating, or binge eating patterns. It can also potentially benefit someone who has tried diet and exercise but has hit a plateau and struggled to keep the weight off. And another potential benefit may be someone who's looking for a needle-free option for weight loss therapies. So GLP-1s, as we know, are injectable medications, and this is a needle-free option that can conveniently fit into your daily routine. As for the safety and side effects, like all medications, this combination can cause side effects. So the most common being nausea, dizziness, headache, or changes in mood. Additionally, with topiramate, it may cause changes in taste, as mentioned through the mechanism previously. And it's important to note that most side effects are mild and tend to improve as your body adjusts to the medication. But as with any medication, you should always report severe side effects to your doctor. So, also looking into who should avoid this medication, it is not recommended for people with history of significant kidney or liver problems, as well as history of vision changes or glaucoma, those with active substance use disorders or alcohol use disorder, as mentioned previously, due to that naltrexone element. We also say it should not be used in women who are pregnant or breastfeeding, along with people who have a history of seizure disorders or severe depression. All of these things should be screened for and evaluated by your prescriber before being considered for a patient of the therapy. But fortunately, Shed is here to support you with that selection and assess you to see what you may be a best candidate for. And then lastly, with MIC B12, this is one of my favorites to discuss, but MIC plus B12 is sometimes referred to as a skinny shot, and then we can break down what's in it, how it works, who might benefit, and then what the safety profile looks like. So MIC stands for methionine, inositol, as well as choline. And then B12 stands for our vitamin B12 agent. The MIC portion are called lipotrophic agents, which are fat burners because they help your body process and eliminate fat more efficiently. When you give these in combination with B12, an essential vitamin that comes from our diet and supports metabolism and energy, you get a powerful blend designed to enhance your weight loss efforts and overall well-being. So, one of the ways of how it works, we can cover by looking into each component individually. So methionine is an essential amino acid, which means our bodies that do not make it on their own. We have to get it from our diet, essentially. So it plays a critical role in breaking down fats in the liver, helping your body process and remove extra fat more efficiently. This can be especially helpful if you're trying to lose weight or improve your liver health. Initially, or additionally, inositol, our second ingredient, is a nutrient that's closely linked to the B vitamin family. So one of its key roles is to help your body respond better to insulin, like some of our other medications we've already discussed with improving insulin sensitivity. But it also, that's our hormone that controls blood sugar. So insulin plays a key role in the body when it comes to weight management, which is important to understand. By potentially enhancing insulin sensitivity, inositol may help regulate your blood sugar and support healthy metabolism, which is important within weight management. And given its role in improving insulin sensitivity, it has also shown potential benefit in conditions like PCOS or polycystic ovarian syndrome, which we discussed previously in our presentation. Next, we look into choline, which is an essential nutrient that it serves multiple functions within the body. It's involved in brain development, muscle coordination, as well as metabolism, and choline helps transport fat out of the liver so that it can be converted into energy. And it also supports healthy nerve and brain function, which is pretty cool. And then lastly, our vitamin B12. It comes in the form of cyanocobalamin, but it is a water-soluble B vitamin that is well known for its role in boosting energy levels, and we see it often co-formulated in some of our GLP-1 therapies. So it helps your body turn food into energy and supports the overall health of nerve cells as well as the formation of red blood cells. So B12 can help you feel less fatigued, especially if you're on a weight loss plan or taking medications that sometimes can cause tiredness, such as GLP-1s. But looking into potential benefits and potential candidates, we want to know who or what you can expect from MIC B12 injections. Some of the potential benefits, as listed below, include enhanced fat metabolism. So by helping your body break down and use fat more efficiently, this can support weight loss when combined with a healthy lifestyle. Additionally, people may report a noticeable boost in energy, mental clarity, and stamina without the jitters and crash that come from stimulants like caffeine, which I'm going to move my coffee aside on that note. And then lastly, these injections may also help regulate your appetite, making it easier to stick to your eating plan and avoid cravings. And they can also provide early stage support for weight loss, helping you get over that initial weight loss hump and see progress sooner. Then looking into who might be a candidate with all of those considerations, this could include people who are taking GLP-1 medications and are experiencing fatigue or low energy, as well as people who are looking at it in replacement of a GLP-1 therapy. So those who are looking for safe, effective ways to boost their metabolism and energy levels, in addition to patients with insulin resistance, as mentioned previously, in conditions like PCOS, along with anyone seeking support in early stages of their weight loss journey, along with diet and exercise. So lastly, this takes us to the safety profile and side effects of the medication. So MIC B12 injections are generally well tolerated and considered safe for most people, given their background of being nutrient-dense, vitamin-containing formulations. But side effects are rare, but they may still occur, and they are usually mild. So some of these can include a mild metallic taste in the mouth, mild nausea, flushing or a warm feeling, such as the redness in the face, along with tenderness, redness, or minor discomfort at the site of injection. So it's important to stay well hydrated, as the increased fat metabolism could put a little extra strain on your kidneys if you're not drinking enough water. So we just want to make sure we're being preemptive and taking the right steps to support our own weight loss, especially when we're taking the measure to inject medication. Hydration is absolutely key. So if you ever experience any unusual symptoms, you should contact your provider. But ultimately, in summary, MIC B12 injections combine natural ingredients that work together to help your body burn fat, boost energy, and support healthy metabolism. They're a great option for people who want non-stimulant, non-surgical approaches to weight management and wellness. And the injection, along with our other two capsule formulations, both bupropion with naltrexone, along with metformin, naltrexone, and topiramate, all of those formulations mentioned previously, they work best as a comprehensive program that includes healthy eating, regular physical activity, along with ongoing support. So they're by no means a replacement, but they're definitely a tool that can help you jumpstart your weight loss journey. Thank you for listening into my presentation, and I'd be happy to answer any questions you may have.
Thank you so much, Stephanie. That was amazing. I know we have a few questions already in the Q&A box that we'll start answering, but
Sure.
feel free to continue to drop questions into that box, and I will kind of moderate where they need to go as they come in. I am also going to add Valerie, who is the director of clinical operations over at Strive, as a panelist in case there's any questions that she needs to answer. So I'll go ahead and do that really quick. Okay, perfect. All right, so the first question that came in is, how has the new law making compounded GLP-1s illegal affected SHED's ability to provide the meds? So I'll go ahead and take this one. The head of clinical operations here at SHED gave me some information to pass along to you guys. So she has said that compounded GLP-1 medications can still be prescribed by a licensed provider and filled by a 503A pharmacy even after they're removed from the FDA shortage list when there is a medical need, such as customizing the dose or formulation or benefiting from additional additives like glycine or B12, which may help reduce side effects like nausea. This is determined on a case-by-case basis by a licensed provider based on the individual patient's needs. So that's kind of just a summary to answer that question. We also have a couple of blogs that have newly been published that go into detail about this. I know there's a lot of talk online and those sorts of things about this specific topic. So I will go ahead and drop those two blogs into our chat here. So feel free to open these up and read through those. Let me grab those links again. All right. So there's the link to two blogs that have been recently published. And then, of course, as the social media manager, I have to send this post that I posted on our socials last week that really breaks it down and kind of compares that 503A versus 503B and how this is kind of affecting access to GLP-1s. So hopefully that gives you guys a little bit of information. Okay, next question is this medication the same thing as low dose naltrexone, which we launched a couple of months ago, also known as LDN, or are these different? So I will go ahead and kick this over to either Valerie or Stephanie, whichever one of you would like to answer this one.
I'd be happy to answer this one. So it is very similar to low-dose naltrexone. Now, the difference between the types of low-dose naltrexone we offer is that we have a flex-dose tablet, as well as formulations where low-dose naltrexone comes in a capsule, where it's typically formulated with another medication. So our low-dose naltrexone taken alone may come in a 1.5, 3 milligram, or 4.5 milligram dose, and those are typically prescribed when we're seeing it for an anti-inflammatory or immune modulating use versus when we use it for weight loss, we'll see a slightly higher dose, such as 8 milligrams, and that'll typically be dosed up to twice daily. So it can be a little bit higher dosing when it comes to its use in weight loss, but again, it is the same active ingredient, just in different amounts.
Perfect. Thank you, Stephanie. I see kind of a follow-up question to that as well, just about if you are taking LDN, how can I switch to one of these medications that you spoke about today? Just to be clear, these medications that Stephanie just covered have not been launched officially yet with Shed. We wanted to provide a little bit of education prior to their launch, but we are very excited to announce that those will be coming very, very, very soon in the near future. So in order to switch from any sort of medication that you might be on currently with Shed, you will have to go into the Shed portal to schedule a appointment with a provider to discuss potentially switching to one of our new medications once those do become available. So just wanted to answer that follow-up question as well. How can I switch from GLP-1 to MIC B12? In terms of the process that you would need to go through, it's similar to what I just mentioned with LDN to one of these options. You would have to go and schedule a appointment with the provider to see if you would qualify for one of these options and which would be the best option for you. But Stephanie or Valerie, maybe you can kind of expand on this of like what that might look like for a patient who is switching from a GLP-1 to MIC B12 or one of these other options.
Absolutely. So this is a medication that we'll see sometimes given in conjunction. So they are compatible and you wouldn't have to worry about washing out the medication or having a period where you're off of a GLP before switching to MIC B12. So fortunately, they can be done together, but in the process, if you're looking to transition from one to another, that would really just have to be a conversation with your provider to look again at um, all of your individual factors, have a patient appointment and assessment to make sure that you're a candidate. And then at that point, you would be able to transition over with a prescription.
Awesome. Thanks, Stephanie. I see some questions in here on what is the price for each med. And let's see. So I'm gonna do that one really quick. So right now, because these haven't been launched, I'm gonna drop the link to the website in the chat right now. You can view all the details. Of course, Stephanie covered it in great detail today, which was awesome, but we have some additional or kind of covering those same things with each of the medications on our website for now. And then there's the option to join the wait list so that you'll be notified whenever those medications come live. And there's also a 30% discount off of your first month of all of these medications when you sign up to join that wait list. So definitely an awesome option to be the first to know about pricing and all the details there. So I will go ahead and drop our website there. You can click into the weight loss section and it has the list of these 3 medications there that you can see all those details on. All right. There's a good one here that asks, can these therapies be used in combination?
So that is a great question. Some of it will depend on what medications you're taking altogether. For example, we wouldn't recommend traditionally taking 2 medications that contain the same ingredient. So for example, something like naltrexone, because it's in those first 2 capsule formulations, those would typically not be taken together versus something like a MIC B12 could be taken in conjunction with the other 2 capsule formulations. Again, it's good to assess also that our medication therapy is working. So I think I would consider starting one agent for starters and then looking at the addition of another medication so we can assess what's working, what's not, and get a fair gauge for each. But that's a
Awesome.
great question.
Yeah, thank you, Stephanie. And I do just want to follow up on the previous question about pricing. If you do go to our website under the weight loss medications, the pricing is actually currently listed there, so you can get a little bit of a sneak peek into those details there. Um, let's see here. There's one that says, I have almost hit my weight loss goal and I'm thinking of what to do next to wean off, I assume of a GLP-1 medication, or what is the plan after?
Sure. So any of these combination of medications, whether it's the first bupropion with naltrexone, our second combination, or MIC B12 could be considered. I think it just depends on your patient-specific variables. So whether you're someone that's open to an injection or if you want something non-injectable for routine maintenance, it all depends on your individual preferences as well as your candidacy. But once you have a screening, I really think that any of these three options could be considered to allow you to continue your duration of therapy off of a GLP-1 medication.
Awesome. And we do highly encourage with this to message into our member success team. They can get you connected with a provider and you'll be able to have these discussions with your provider to talk about those more like personal details about whether one of these options would be a good fit for your specific circumstance. Um, let's see here. Can these medications be used as maintenance and or for long term?
That's another great question. So there isn't a suggested duration of therapy. They could be used ongoing, but again, depending on those side effects and what your goals are, something like bupropion that can influence mood or be used as an antidepressant may be set to a limited duration. It depends on your individual comfort and your goals. Of course, these are meant to be used in addition with diet and exercise, but something like our lipotropic shots, especially MIC B12, we see used similarly to a vitamin supplementation or nutrient supplementation. So again, that will help us just supply those things in excess and make sure that our body is utilizing them efficiently. Anything in excess, such as a B vitamin, will get washed out of our system once because it's water soluble at sufficient levels. So that's kind of like giving our bodies the tools to run efficiently, and then we'll be able to decide what we need and our body can use it efficiently. But ultimately, the answer is the duration can be done as long as you're looking to lose weight, or you could have it at a set duration and say, I've reached my goal, but if needed, I can always consider going back on it.
Are any of these meds safe for pregnancy?
So that would have to be a discussion with your provider for sure. One of the things I will mention is typically we don't encourage the use of any agents that we don't need during pregnancy. So again, weight loss is kind of a gray area, especially when it comes to pregnancy. And I wouldn't want to encourage the use of weight loss medications or anything that can interfere with that process.
All right, and then last question here. Can MIC plus B12 help with stubborn belly fat?
It could. So it is a weight loss agent and it'll work across the body, of course. So that's not to say it's localized to a particular area, but again, it will contribute to the loss of overall fat. So as we lose weight across the body, we'll see it in areas where we tend to pocket fat, which may include the stomach for some people.
All right, well, that's going to wrap up our Q&A for today. Don't go quite yet. We have some super exciting news to share with you in just a minute. Thank you so much, Stephanie. I'll kind of do a little bit of an outro, and then I will leave you guys with that waitlist link again at the end. So as I shared a little bit already, we are going to be launching these 3 new medications in the very near future, which we're really excited for. We do currently have a wait list that you can join. The link is up above. Let me get you that exact link really quick so that you can go straight to that wait list and you will get 30% off of your first month of your medication. As always, we do say that these medications are tools, not magic pills. So they do work best when combined with habit and lifestyle change. So things like mindful eating, movement, stress management, and accountability. And of course, that's exactly where Shed comes in with our health coaching program. Not only are we so excited to be announcing the launch of these medications very soon, but we're also really excited to let you guys know that with 2 of these new medications, the Naltrexone and Bupropion, as well as the Metformin Naltrexone and Topiramate, we are offering 2 free health coaching sessions per month included in that medication subscription. So we're super excited to be able to have our health coaches really walk you and guide you through this weight loss journey with these new medications. We will be following up with an email with the replay of this webinar, so you'll have access to this information moving forward as we get ready to launch these medications. And then again, just as that reminder, the wait list will provide that 30% off of your first month of medication. Thank you guys again so much for being here. Thank you, Stephanie and Valerie, as well, for sharing your time and sharing your expertise on these medications. We cannot wait to support you as you continue your journey to becoming the healthiest, most confident version of you. Have a great day, everyone.
Thank you so much. Take care.